My name is Chris and I'm an iFuse patient. My SI joint pain started in 2019 after I'd been cleaning pools for a while. It just never went away. My pain felt like just a constant aching and sometimes even like a jolt. I used to participate in bass fishing tournaments, so I'd be standing in a boat sometimes 12, 13 hours a day, and the thought of trying to do something like that once I had the back pain was not even an option. And things like golfing and hiking and just things that take a lot of physical activity and movement were just, I didn't want to do them. I avoided them because I didn't want to be in pain. I tried physical therapy and that didn't help. Did injections, which gave minimal relief. This left me feeling pretty frustrated, and I decided I wanted to seek a different path and did some Google searches, and I came across the iFuse website and watched the video and gathered all the information that was there. And there was a directory of surgeons in my area, which was real easy to use. And I found Dr. Chan and watched his video, and I felt like that was really who I wanted to do my surgery.
Hello, my name is Dr. Homan Chan. I'm an orthopedic surgeon here in Las Vegas and Henderson, Nevada. I work with Nevada Orthopedic and Spine Center, and I'm an orthopedic surgeon trained in foot and ankle and trauma surgery. The sacroiliac joint functions well as a shock absorber between the ground forces as well as your lumbar spine and the rest of your body. So when a patient comes to me for lower back pain, the most important thing for me is history. Really listen to where they feel the pain, what activities are bothering them, because that gives me the biggest clues as to where the pain is coming from. After taking a detailed history from the patient, I really want to focus my physical examination and really try to tease out between either lower back pain and kind of hip pain from sacroiliac joint dysfunction. I do perform the Fortin finger test. I have them point to the area of pain and I mark that down. Other things that I would do are stress the hip and flexing the leg in a certain position to try to stress that sacroiliac joint and see if it causes pain to them. The next step for me would be an injection into the sacroiliac joint. Usually this is performed with radiographic guidance. The injection itself numbs up the joint almost immediately. So the patient, after about a minute or so after the injection, they come to me and say, oh my gosh, my pain is almost completely gone. To me, that's a very useful sign. It's a very good diagnostic tool to prove to the patient as well as myself that the sacroiliac joint is the pain generator for that patient. So once we've confirmed the diagnosis of sacroiliac joint dysfunction for the patient, in my practice, I always try conservative management first. We like to try physical therapy, bracing, activity modification, medications that may help the patient. The next step would be to try therapeutic corticosteroid injections. The steroid that's injected is used to help decrease inflammation to this area, and these can last for quite a period of time. These injections don't affect anything mechanically, and a lot of times these injections become less and less effective as you get them. So after trying all conservative measures, unfortunately if the patient fails this and still has the symptoms, then we're having the discussion of sacroiliac joint arthrodesis or fusion. And the common implant I use is iFuse from SI-BONE. I was introduced to this implant because of its minimally invasive approach. It allows me to do this procedure through a small 2 to 3 centimeter incision while the patient's asleep under general anesthesia, and I'm able to insert this implant without destabilizing the joint. It's an outpatient procedure which takes approximately 1 hour. It allows the patient to walk afterwards, and almost immediately they tell me that they notice a difference in their pain level, or at least the character of their pain.
When we decided on surgery, I really didn't have any hesitations or hang-ups about it because I was in so much pain. I was desperate to try something. Dr. Chan assured me that he really felt like this was going to provide me with a lot of relief and allow me to get back to normal life like I knew it before the back pain started. After the surgery, a couple days afterwards, I was able to start walking in my neighborhood again, and I believe it was about 6 weeks, I was able to start golfing again. And you know, slowly but surely my life kind of started to return back to the way it was before. I can golf multiple rounds in a week instead of just one. And I can go on walks and hike, and we can do things as a family, and I don't have to isolate myself because of being fearful of being in pain afterwards. I'm so thankful to iFuse and to Dr. Chan for just giving me that opportunity to return to normal life again.
So if you're frustrated with your care and would like to learn more about sacroiliac joint dysfunction, please call our office or go into our website, and I look forward to being part of your care.